Good evening to all the viewers who are watching live and will be watching in a pre-recorded version. Uh, this is me, Orko Mukherjee, the IT manager for NIH Alumni Association, and also just few things to say before the start. That if you liked our IT works, then please do give us some super chats in this program so that we can just comply and improve our way with your super chats and super stickers. It will be on the comment section where you will type. It will be on the right side of it. Please click over there, and if you want to give a little bit amount, it will be best for our IT team. So without this, it means without wasting any more time, let's just start our today's panel discussion with first 30 seconds countdown time.
Good evening, everybody. Good evening, sir. Our
Good
President,
evening.
Dr. Narayan Kalyani. And tonight, good evening, sir. And tonight, we are on a very auspicious day. Our 46th CME is being held on 267th birth anniversary of our great master. And for tonight, we are not going on any other regular topics, a discussion. But tonight we had planned to have a panel discussion, a very strong and bold panel discussion to be hosted by our President, Dr. Debnaran Kalyani, sir. And we have a very eminent panelist in our discussion tonight. Director of National Institute of Homoeopathy, Professor Dr. Subhash Singh, ex-principal of Burdwan Homeopathic Medical College and Hospital, Professor Dr. Pannalal Desa. We have with us our eminent scholar and Professor Dr. Kisore Kumar Naskar. We have with us our beloved friend and very popular figure across the homeopathic fraternity all over the globe, Professor Dr. Rajat Chattopadhyay, who is also the principal and administrator of Calcutta Homeopathic Medical College and Hospital. And we have with us Board of Studies member of Maharashtra Health University, Nashik, Professor Dr. Partha Pratim Roy. Our director was the inaugurator tonight, but I'll request as our director is in the airport now on the checking session. Shubhas sir, I think, is in. Okay. We'll request our president, Dr. Debnaran Kalyani sir, to inaugurate and start the session. Our director, Dr. Subhash Singh, had already permitted to start the program, and he will be joining once his checking process is over. Over to you, Kalyani sir.
Thank you, Bidyut. Good evening to all the eminent speakers of the day, Director National Institute of Homeopathy, respected principal of the uh, very famous oldest college, Calcutta Homeopathic Medical College, Professor Rajat Chattopadhyay, our senior Dada, former principal, Professor Dr. Pannalal De, Professor Dr. Kisore Kumar Naskar, HOD of Calcutta Homeopathy Medical College, Medica, Professor Partha Pratim Roy, all the viewers and who will be seeing later on. It's a great privilege for us, and we are very lucky that very much eminent speakers, great contributors of present homeopathic day, we are able to get them in this session, this 26th CME of National Institute of Homeopathy Alumni Association. And today's topic is a very brilliant topic. See, behind every success, there are some spirit. And that spirit will be discussed today by the brilliant speakers. It is expected that we will get many things to improve ourselves, especially for the students of BHMS and MD who needs immediately to be toned up for future expected progress. So without wasting much time, as our respected director Dr. Subhash Singh has permitted to start the program, let us start the program. And may I ask, in the beginning, we have arranged in this manner for about 20 minutes. Will be extempo speeches from the learned speakers. Then there will be question answer sessions. After question answer session, if it is needed, there will be some cross discussion. And finally, there will be some key words from all the speakers that will help our students, at the same time doctors, in their near future. So without wasting much time, may I request Dr. Professor Parthopratim Roy to start his speech as a beginner. Dr. Roy.
Yes, sir. So the topic that was suggested for today, understanding knowledge, aptitude and perception in classical homeopathy towards BHMS and MD students. So the subject matter is very encouraging and the day of the need, and the attempt taken by at least 2 persons I have seen in different social medias. One, a circular was issued by Director NIH to prescribe single medicine, and another recently by Dr. Rajat Chattopadhyay. Fortunately, he is with us. That he had also published some statement like that. He the classical homeopathy prescribing single drug and other thing. At the very outset, I would like to say one thing. The what exactly the panelists are there, so they are going to discuss. What exactly we should mean by this word classical homeopathy. Number two, the matter of discussion should be extended from all the speakers' side, because the beneficiary of this treatment, that stakeholders. So the terminology we are now regularized for the NAC NAAC, National Accreditation Council's activity, because all the colleges and schools and these naturally homeopathy colleges in the state of Maharashtra has been asked to do NAAC accreditation and NBH accreditation from the central agencies. So the were stakeholders, that how they are getting benefited. Third issue that should come, in order to propagate this knowledge, how much the government is activated their systems, because I am from Maharashtra state, so the condition of Maharashtra state that obviously will come to my account. And last but not the least, what is actually getting demanded means new syllabus pattern is to be given, new something should be incorporated, whether the syllabus presented by Central Council previously, now gone to another agency, whether it is okay or whether it is to be changed. Now, very truly speaking, last day for this 10th April session that was occurred by the council in Delhi today, because most of the people had gone there. So they had taken a long discussion with the principals of different colleges. The real outcome that had came in in MP, till yet more than 45 seats are vacant. In Maharashtra state, for the private, and because in Maharashtra there is no government medical colleges, so more than 60% seats remain vacant. A recent study for the state of Maharashtra, among the 400, more than 500 seats for MD, more than 50% seats are remain vacant. Nevertheless, as per now, the entry of the syllabus system is coming from a single gateway entry, that is through NEET. The second round is yet to be declared. So the first year syllabus, recently how it was framed to be completed by 1 year. The basic fact is the examination of the student was expected to enter to the first BHMS in August 2021 is still vacant. Now, these are few facts I put before the fraternity to get it assured, because this is the present scenario that is happening in all through India. So when I speak of the classical homeopathy and how to bring it in the syllabi, so that comes is a genuinely great question, because I'm the first speaker. So just I am taking the advantage to put questions before the fraternity, our co-speakers, that what they are basically thinking on doing this. Because from my perception, in order to give a very structuralized syllabus is very important thing. I want to share one my experience, because I am working as a HOD and professor in the Department of Organ and Medicine. Since last 10 or 15, 10 years almost, we are writing for several times the psychology chapter to be included in final year syllabus. Still, it is there in first year. Our conviction was, because the psychiatry is getting treated, getting taught in final year practice of medicine, so why not that can get a correlate with this theoretical topic? So that not yet happened. I feel this is the common experience, because in several seminars and because of severally this OTT platform, we have talked with several college mates. So they have got the same complaint. The syllabus as been structured is not proper. Second issue, what I feel that is coming from this MD syllabi, the syllabus that was structuralized by in a very gross manner, whether it can be formulated in another way. Because in the syllabus pattern, we have find 4 or 5 kinds of syllabus that came. Now, when we speak of a classical homeopathy, a standardized method is demanded, then how much these changes will be solicited? Because there is a lot of adaptation problem. Now, presently, we have got a 5 months paper for MD syllabi, the 3 papers in first year, and the 2 subject personal, the specific or specialty subject in the second year. Now, what is observed? MD syllabus completion, the people are trying to get a government job. That is my present experience. So if the syllabus does not provide enough confidence to the student to practice homeopathy, and if every people tries to get some job, then what will be the future for homeopathy? So this is the very initial few topics I put before the panelists. I think the panelists will speak on that. And later, obviously, I will join with my other inputs. So I will request Kalyani sir. Sir, from this, I have started my beginning. Now let us see what the other of my beloved and respected panelists tells regarding this issue, to define what is mean by a classical homeopathy, what will be the conditions of stakeholders, what is the changes required from the government level, what is the changes are required from the syllabi pattern, and ultimately what we are to give to the fraternity, to the world. Thank you so much, sir.
Thank you, Dr. Partha Roy, for his nice queries, basic fundamental queries for everyone. Now, may I request now to Professor Dr. Kisore Kumar Naskar to give his views on the subject. Professor Naskar, please.
Thank you, sir. Thank you, sir. Respected my panelists, Director, sir, National Institute of Homeopathy, Principal, sir, the Calcutta Homeopathy Medical College and Hospitals, my friend, Dr. Partha Roy, and Pannalal, sir. First of all, as an educationist, involved in the education of the homeopathy, in classical homeopathy, it is given that understanding knowledge aptitude and perception in classical homeopathy towards BHMS and MD student. It is the topic. Uh, as a member of education of this system, what should be the syllabus and what should be the curriculum of BHMS or MD homeopathy? It is a great question. Uh, for the very beginning in our homeopathy, the old syllabus, syllabus are changing frequently. But my question, we have to adapt or we have to add something new in the course, because for the development of homeopathy, uh, it is required. So input of some ideas, what should be there to progress much more than the earlier, because science is the constant process, and so our homeopathy is a science, obviously is a science, so it should be on the way of progress for the development. So as a member of education of this system, I can say the fundamental of homeopathy, the basic fundamental of homeopathy based on the homeopathic pathogenesis and its application to the cases. But this homeopathic pathogenesis, it is from different sources. Obviously, the drug proving is the number one. Others are poisoning, the clinical experiences of the pioneers. The application of this pathogenesis to the patients through some process, that is individualizations, or you can say the totality of symptoms. And this totality of symptoms based on the symptoms of the patient as well as pathognomonic symptoms of the disease. So these manifestations of the drug and the manifestations of the diseased persons are required. But it is actually the cause and effect relation, something deviation and causes the manifestations. But my point is, we must add or we must input these ideas, as this homeopathy is a science and we have to progress, develop our homeopathy. So in between the cause and effect, something is there. We have to reveal it through research, through study, different study. So in this aspect, especially for the students who are postgraduate students, the related actually the in between the cause and cause and effect, something is there. How this medicines are acting, how these manifestations occur, something related to internal pathophysiological changes. And this is the subject. And according to Hughes, it is the internal phenomena which causes the disease or which causes the manifestations after drug proving or after taking the drugs. So in this process, this cause and effect, there, from the knowledge of pathology, the phenomena are always illuminated and sometimes even rendered transparent so that through them we can see the phenomena. This is the version of Richard Hughes. And Dr. Borick says a knowledge of pathology of disease is necessary to interpret the symptomatology obtained and prescribe the truly indicated remedy, and not merely on externally homeopathic. So in this regard, we have to study the drug and their proper applications. The proper applications mean what? According to our principle, single medicine, minute doses, and in some conditions, single medicines followed by some pathological prescriptions. It may be with the constitutional medicine. So in this process, if we study overall this type of phenomena or the attitude, then we can develop our science. Thank you.
Thank you, Dr. Naskar, for giving valuable experiences and ideas for our further development. Now, may I request now our senior Dada, Dr. Pannalal De, to give his views on the subject, please. Dr. De, please.
Dr. Mukherjee, Bidyut Mukherjee, and the speakers, Dr. Rai, Dr. Naskar, our Dr. Rajat Chatterjee, and Dr. Subhash, Singh. I am very glad to meet you today, specifically on the day of Hanuman's birth, on the 267 birthday. However, already we have heard about the problems in relation to the particular topic presented by Dr. Rai and Dr. Naskar. In this regard, I'd like to mention something that as Dr. Rai presented something that the government policy, syllabus, curriculum, then vacancies, process of admissions. These are actually creating some problem at the present state. I was in the education for last 2 years. I left that as I reached to my specific age. So, however, as I know about the syllabus, curriculum, and the government policy and present vacant seats, process of admission, definitely this is a very transition period. Here is again new authority developed, the commission. They are also taking certain special decision. They are also going to change certain syllabuses. That is true. That we have to time, it requires to change as per the demand of the situation. That is true, but still there are certain situations or certain curriculum changes in the curriculum or syllabus or government policy may affect the progress of the homeopathy as a whole. That is to be definitely find out by the academicians at present or in future, whenever required, and they should be they should try for rectification. They must communicate with the specific authority so that the appropriate steps of action can be taken and the hindrance for progress of the homeopathy can be removed. So that is true. Government policy definitely, syllabus curriculum definitely it will affect, and vacant seats definitely. So apart from that, this curriculum is there, syllabus is there, government policy is there, but adoption of the policy, adoption of this your syllabus, that is very, very important. And that responsibility, whatever may be, that responsibility actually remains on the present educational institution on homeopathy. We must be sincere about that. Only then it is possible to rectify, it is possible to faster progress of the homeopathy. Because it is true that at present time, medical science is progressing very, very fast, very, very fast. But as regards this homeopathy, it is not getting pace with the other branch of science, other branch of this your medical science. That's why it appears to us that we are lagging behind somehow, and we are not getting seats full, that is vacant seats are remaining, or some sort of irregularities are coming out. Sometimes the confidence of the students before entry, during study, and also after passing. This is very, 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 very this is painful to us. Very, very painful to us. Many of these students, those who passed, they are joining to some nursing homes, they are joining to some school, they are joining to some clerical job. This is very, 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 very painful. This is failure in our system. This is failure in our system in adoption of the policy, adoption of the syllabus, adoption of the curriculum. That is true. This is required to be removed. So, if we actually want to progress, we need our rectification within ourselves. However, as regards the adoption of the policy, I am also like to say about the adoption or the application or implementation of the syllabus curriculum. In that, it is a science, medical science is science of experience. But homeopathy at present stage, we are teaching the students, we are giving training to the students without adequate, that is called adequate this your experience. Whether it is a case of anatomy, whether it is a case of is your physiology, pathology, or what is called organon, or some clinical subjects, or your Materia Medica, practice medicine, whatever it may be, we need to develop our institutions to give extensive practical training to gain experience in relation, in respect of the homeopathy. So question of homeopathy, classical homeopathy, it is classical homeopathy that is, I like to say that classical homeopathy is actually homeopathy is simple, a law of similia, that is homeopathy. Who is following that law? That is homeopathy. Apart from that, there are several types of prescriptions, and homeopathic medicines are used, or homeopathic medicines are used by someone or the homeopathic doctors. If they are not following the law, that is not homeopathy. So homeopathy is one, that is who we are following the law of similia. So in that is deduced from the, we know they deduced from the natural facts, and that law, how to implement, that is very important. Where to implement, how to utilize, that is very important. So that part is most important to make understand, to give proper knowledge, proper perception on the subject to the students, whether they are of that they are of undergraduate or postgraduate students. So that implementation requires extensive practical training, even from the very first day of the organon, we can start practical training with these patients. As for example, I can say that simple symptom, we give lectures 2, 3 times, 4 times, 5 times, even we are not able to get the answer from the students. There are students, good students, they can perceive very easily, they can understand very easily, but most of the students, they are not able to answer. What is the reason? Only if we place one a patient in front of them and say, and what is your problem? Then the patient definitely they will answer with their symptoms, and that can be simply that will make them to understand the students. They get this experience whenever there is health, whenever there is disease, there are symptoms. If there is no disease, are the healthy conditions, what are the symptoms, what are the features, so they can understand easily from the very beginning. I am not going to the deeper, that is the more complicated thing with the case taking. How to take up the case, we give lectures several times, and they follow also. But if you present this case taking, how to this practically, how to question to the patient, because every question are not asked to the every patients. There are several varieties of patients. Some are coming with the headache, some are coming with the constipation, some are coming with the chest problems, heart problems, kidney problems, or these your menstrual problems, some gynecological problems. So everybody are not asked all questions. Is there a very sequential questions as per the answer of the, or as per the presentation of the uh, patient we get, according to those who are experienced, how to uh, search the symptoms, how to questions, how to this your clarify the symptom. That is only can be done through this year practical experience. That is very limited to our this year institution. That requires to be improved, to improve our this year students, to improve our this year homeopathic standard, to make them knowledge of the homeopathy understanding. What is called knowledge is simply the facts, but understanding is different. Understanding requires reason, cause, awareness of the facts or the situations. So to give them practical training from the very first day, less theoretical. That is my experience from this year, last few years in education. That is lacking in our institution. That requires to improve our and our this pathway. At the same time, to give these trainings, we need the improvement of our hospitals. That requires government policy, that requires local policy, that require is your institutional policy. That we must be equipped with the modern equipments for training, for investigations, so that we can progress, we can correlate our homeopathic science with those utilizing this modern science, and we can progress with the other science of medicine. That is very important. That is very important. And at the same time, also in need this your what Dr. Naskar pointed out, that scientific investigations are definitely required, as regards this your medicine, that we have the potentized medicines, how they are act, where they are acting, how they are changing. That is mechanism of action, mechanism of cure. Definitely not at present. The advanced science, with the advanced science, we have to proceed to explain our science with the advanced allied science. So that is needed. That is needed so that it will be helpful, and also it will create confidence on the students, doctors, at the same time the patients or the population. So that is very important. That is very important. So we need to modify ourselves. We need to modify ourselves to standardize our different application of or adoption of our curriculum, syllabus, and also policy. For that, definitely conjoint effort is required, not only one institution, it is all institutions, all academicians, all the homeopathy colleges in India, so that only it can be possible to progress our faith, and we can have the perception, clear perception of the subject, clear understanding of the subject, and we can improve our aptitude as regards the issue benefits of the society, benefit of the patients. So, and that is the my this your concept regarding this present situation. Thanks to all. Hello.
Thanks, Dr. Pannalal De. Many thanks for giving.
Hello.
Hello. Am I audible now?
Hello.
We are really thankful to our senior Dada, Dr. Pannalal De, Professor Pannalal De, for giving practical experiences how to improve the system. So let us, may we now request Professor Dr. Rajat Chattopadhyay to provide his views on the subject, please. Dr. Chattopadhyay, please.
Thank you. Thank you, Dr. Kalyani. Am I audible?
Yeah, you are audible.
Okay. First of all, Hahnemannian greetings to all. The 267th birthday of Dr. Christian Frederick Samuel Hahnemann, and it is the right time also. I think this is the need of the hour to have this type of panel discussion with the eminent all educationalists, and I know that many others will also join through their questionnaire, etc., etc. So first of all, if I consider the first point of need, there is something different. What Dr. Partho is my colleague, junior colleague. He wonderful mentioned about the current status, the crisis, what is going on in it. But if we consider it from the beforehand to till date, it is something improving the adaptation, which was Dr. Day was talking about this. Then again, we have to adapt with this type of thinking. What is government thinking? Just to improve the standard of the homeopathic student. It is the one part, that is whether it will be okay or it will be not in use for homeopathy. The time will tell. But right now, we can say that this is the beginning period, and we can see the pros and cons of this type of admission through the NEET. So the vacant seats, whether I can say as a principal of the Calcutta Homeopathic Medical College and Hospital also, that till date, now we are going through the third phase, and till date 15 seats are vacant in the government college. I know that will be filled up very quick, but till date we have 14 vacancy. On Monday, this is the last date. So even we are also in apprehension that whether within this is the first time the situation is happening that the government college that is within third time, there is a third round, the still this is not the scenario only at my college. I know all the government college status of in West Bengal, but I know that all the seats will be filled up and many of the private college seats will be filled up because this is a new one. Most of the students having very high marks, they have captured the seats of this government college, so they will leave it only before the stray round or before the last round. So then the students who are very keen to take admission in this homeopathy, they will get chance only after these high mark students will leave the seats. Right now, they have occupied the seats. So these are the thing we are with the time. We will adopt this, that this is the scenario because it is very normal to government colleges in West Bengal. Just within 2 hours, 3 hours, within the first day, all the government colleges, including Midnapur Homeopathic Medical Colleges, the seats are filled up. But right now, with the NEET, with the standardization of the students, this type of thing is going on. This is the one part. But also, we have to think that the situation will not same in every year. What was 3 years back, this year 2022, it is something different, and I think it is improving. It is improving. So we may adapt with this. The procedure may fail, but right now we have to adapt with this because this is the policymaker's decision, and we have to abide by the rules, by the laws. The BHMS syllabus. Dr. Partho was talking about the BHMS syllabus. Dr. Kisore also told time to time BHMS syllabus is changed. It is not that only one man's decision or only one committee decision. Whatever the policymakers think, that is on the basis of the market survey or on the basis of some type of, I can say, the research work. On the basis of that, the BHMS syllabus curriculum change from time to time. It is for the uniformity of the syllabus, that's why anatomy, physiology, and pharmacy, only the 3 subjects, just to make the uniformity with the MBBS, with the BHMS or the BAMS, BUMS, all. So just to make the uniformity, they made it. Now, again, whenever, just to make not only the uniformity, whenever we are thinking that organon is not there in the first BHMS, Materia Medica, the core subject, not in the first BHMS, and more than 2 years, 3 years, lot of people, not only from organon, all the homeopaths, they want that organon and Materia Medica should be there. So demand placed, and I think that there should be positive approach that organon and Materia Medica may come because in modern medicine also there's something changed. So we can expect just in our homeopathy also the syllabus may change, organon may come, examination may come. We are not sure about that, but we are very positive in this approach, and we think that within very short time it may happen that organon and Materia Medica may be from first year. So syllabus will be changing on the basis of our demand, on the basis of the right approach of the policymakers also. It is not that any whimsical decision the policymakers take. On the basis of the decision taken by the stakeholders from the educationalist, they time to time they change it. Even the syllabus in PG, man in health and man in disease, whatever concept man in health and man in disease in West Bengal, the same concept is not in the Rajasthan, the same concept is not at the Chhattisgarh, same concept not at that other part. It may be in 2 or 3 states there are some concept of man in health, man in disease, but in many of the states it may like that man in health means the physiological part, man in disease means pathological part, which was not the motto of the policymakers. Right now, if we go through the syllabus from the pathology, physiology, anatomy, the homeopathic orientation is the most important part from the past, since the past till date. If you go through pathology, it is written that pathology, not only the pathology, it is also the miasmatic orientation, the homeopathic orientation in the pathology, homeopathic orientation in the physiology, homeopathic orientation in the anatomy. So only a good homeopath with sound knowledge of allied subjects, they can be a very good teacher of allied subjects. That's why right now, if we go through the all colleges, out of 24 or 28 teachers, faculties, all the allied subjects teachers are now homeopath. It is expected that the homeopathic orientation will be a very easy one for a homeopath whenever he is teaching allied subjects. So, being a homeopath to teach gynecology and obstetrics or clinical medicine, our homeopathic orientation will be good. On that expectation, homeopaths are allowed, BHMS, MD, Home are allowed to teach the allied subjects. When I was student, in the past, in the remote past, the modern medicine physicians also they used to teach surgery, gynecology, obstetrics, and for the homeopathic part, the therapeutics part, homeopathic approach part, homeopaths are there. But with time, it was expected that one homeopath will be a very good teacher with the homeopathic orientation. So homeopathic orientation is very much important. Whatever Dr. Pannalal they was talking, that from the very beginning, massive our bedside teaching or clinical teaching, practical teaching. This is the need of the hour. On whenever one student will see the hamstring muscle pull and in the OPD, and the doctor is prescribing medicine on the basis of the symptomatology, so that student definitely will open the pages of hamstring muscle and what are the conditions of the hamstring muscles, all the muscles from where it originates, where it inserted, what was the nerve supply. But whenever it is in the theory classes that these are the conditions of the hamstring muscles, these are the nerve supply, so it may assumes as very monotonous. But whenever he is observing it, but what is the strength of your OPD? What is the strength of our IPD? So we have to increase our number of patients. So how that can be improved? Only to reach like outreach camp, like innovative ideas, like our faculties, our medical officers, our RMOs. We have to think, the policymakers also think that how the number of patients in the hospitals will be increased. Because if your number of patients in the OPDs and IPDs will increase, then only you can teach your students. And also, this type of teaching will in the students, they can get the confidence, they can see the patients, they can see the OPD, they can see the follow-up, and then only the confidence begin. Another thing I must say, because Dr. Partho mentioned name of NIH, Dr. Subhash Singh, and also myself, my name at the Calcutta Homeopathic Medical College. It is not that we have mentioned only about the classical homeopathy. I never mentioned about classical homeopathy. As per my knowledge is concerned, Dr. Singh also not mentioned about the classical homeopathy. I mentioned only about the single medicine prescription, which is the cardinal principle. The single medicine concept may differ from man to man. I have no idea about the classical homeopathy. I know homeopathy. I know the cardinal principle of homeopathy, which advocated by Hahnemann, and I know some philosophy. As per I know that all the organon faculties, they are well aware. Dr. Partho is the HOD of organon medicine. I am the man from clinical medicine. I may be excused if I tell anything wrong. But it is our concept that whichever as per our cardinal principle of homeopathy. So I have no right to say anyone to say any direction regarding the prescription. It is not that I have their country, they are going, they are not doing the single medicine. It is not like that. I know my 99% faculties, my house staffs, my PGTs, they use only single medicine. I know this. But if 1% also they are not following the cardinal principle. I again talking the single medicine concept may differ. Single medicine concept may be only the one medicine, maybe only one single dose, maybe the 2 doses or 3 doses at a time may be the considered as single medicine. So the concept of single medicine as per homeopathy and organon philosophy may differ. But in the broad sense, the cardinal principle of single medicine, that is not different. It is uniform. So I can only issue this order for my college. It is not my right to issue any order for all the Indians and all the because I am not the policymakers of the government. So in my institute, I am the authority. I have every right to issue any order and to go through to abide by the laws, by the cardinal principles of homeopathy. Because I am a homeopath, I have to follow the cardinal principles. And if I do not follow the cardinal principles, then whatever I am doing, that is not homeopathy. You can do anything, but please not take the name of homeopathy. This is the most important one. And another thing, that is the today's topic, that is the understanding knowledge, understanding aptitude. Wonderful, I can say Dr. Pannalal, they was talking that knowledge and understanding differs. I 100% agree with this. The knowledge and under knowledge of allied subjects doesn't mean that the homeopathic understanding of that allied subjects are already within that student. So how much that student having a sound knowledge of practice of medicine, sound knowledge of gynecology and obstetrics, or sound knowledge of surgical diseases, but without homeopathic orientation, he will not do justice to the profession. So this is the orientation we need. This is the need of the hour, and it is based on the number of patients. We can give immense booster to our students. We have the individualized theory. Now modern medicine have the personalized theory. We have the miasmatic medicines, miasmatic tendencies. Scientific community now are talking about the human genomic project. They are talking about the tendencies. They are talking about the genetic studies, and human genomic project is the main theme project, just to know the about de-prescribing many drug at a time, just to go through again in the very preliminary terms. They are single molecule concept. These are in the large sense, in the crude sense, these are concept from us. You all well aware about the homeopathic influences books by the Coulter. The homeopathic influences, it is in the past. But right now, if we think with the modern medicine, we should not feel any inferior. We should not, the holistic concept can be the mind-body concept, the psychosomatic concept, with the concept of human physiology, with the concept of psychoneuroimmunology, with the concept of psychoneuroimmunoendocrinology. We can explain our holistic concept. Holistic concept is the well-known concept. So our cardinal principle of single medicine, holistic concept, individualistic concept, miasmatic dysplasias, everything can be explained now in the language of science. But where we are lacking, that is in the applications, in the follow-up, in the vigilance, and in the right application, the approach, and in our professionalism, in our marketing. We cannot market our which is our strength. We have to identify our SWOT. We have to identify our strength. We have to identify our weakness. Our weakness is where? Our weakness is in the dynamic concept. Because till date, this dynamic concept is unknown to the scientific community, but scientific community know that they are getting the effects. The patients are getting the advantages. All the society, there are social acceptance with all the pressures. Till date, it is, I can say that with all the pressures all over India, the Ayurveda, it is the land of Ayurveda, but till date in the society, homeopathy is much, much, much more accepted in contrast to our Ayurveda, in our Indian concept. And not only in India, if you go through the whole world, even the European countries, the popularity of homeopathy is still, but due to some law, due to some something, especially due to law, they cannot tell it. But it is very popular among the children, among the women, even within the family as a family medicine. So the concept may differ, and I will mention only one or 2 points. That is, one is talking that we have very lacunar. Probably Dr. Dey was talking, we are not giving the proper teaching because we are the educationalists, so we have to take the responsibilities. We are not providing the correct teaching. We are not providing the bedside teaching. We are even, our students are passed out and they are going through the nursing home and they are working. So whether they are working with knowing nothing, and only 2 months or 10 days, 15 days work in the nursing home and they are becoming expert. So they know everything. So they are well equipped with the clinical medicine. At least out of 12 subjects, 8 subjects are allied subjects. Na? So they are well equipped in these allied subjects. So that's why they are all in the nursing homes. It is not very easy to take entry in the nursing homes. Even the MBBS doctors, they have to go through very tough race to take entry in the nursing homes. It is not that all the nursing home is inviting you, all BHMS and BMS, please come, please come. So they have to face also the competition, and they are very equipped. I know my students, all the BHMS, BMS, they are very well equipped. They are having very good standard. Out of feeling inferiority that I may be inferior than MBBS students, they read more. They have much more knowledge in comparison to other pathy. So they are very well equipped. But where is lacking? In the homeopathic orientation. Where is lacking? That is in their confidence. So we have to inculcate confidence. We have to show. And in every pathy, there is something scope limitation. Even the COVID situation since last 2 years, it showed the limitations of modern medicine also. And it is well accepted. It is not that I am telling. Everyone is talking, everyone. With last 2 years, we have been observing the limitations of modern medicine also. So why we should feel inferior about our homeopathy, that these homeopathic medicines has got the only limitations? Wherever you have scope, whenever in all the self-limiting disorders, we have the scope also with the modern medicines, but in that case, drug abuse is much more. There may be side effect in comparison to Ayush subjects in Ayurveda or homeopathy. There is no such side effect. So why should not we concentrate on all those self-limiting disorders, all the autoimmune disorders, all the somatoform disorders, all the psychosomatic illness, where our homeopathic part of case taking will act like counseling? And another point, my last point, that if all the good students will be selected for PSC, all the good students will be selected for UPSC, all the good students will be selected for research fellow, junior research fellow, senior research fellow, all the good students will be selected for research officers, all the good students will be selected for PhDs, then only the average and below average student will practice. So do you think that it is the justice to the profession? Only the students who are very average or below average, or who have no interest in homeopathy, and they will practice homeopathy. And for homeopathy is still living for the practitioners. Till date, the diploma doctors, the co-op doctors, the RMP doctors, whatever they are feeling about the Materia Medica, organon, and they practice homeopathy with the faith that this brownia will work, the single medicine will work. This is the confidence they have, which we have the lacuna. Being the BHMS, MD, PhD, we have no such confidence in comparison to all those old people. So where we are lacking and why? This is the question. This is the need of the hour. The changing in syllabus, the changing in the policymakers of NEET and vacancy of seats. These are not our permanent problems. These will come. This will disappear with the time. The ultimate permanent empathic orientation we are lacking, and the practicing. We should encourage the students to practice. If your good students will work under government service and in the community field, and they are not using their skills of homeopathy in the artistic way, what homeopathy is, the homeopathy is losing its main human resources. That's why homeopathy is lacking. Just you think opposite things. In the all average student, most of the average and below average students, they used to find their work in the nursing homes for the routine jobs in modern medicines. And just in contrast, you think of our system. So we need the right direction, the right homeopathic approach, homeopathic orientation, and just to inculcate the confidence to the students, so that our good students will practice homeopathy. Practice. This is the typical. Only with the practice, one educationalist can teach better. One researcher can do much more the research. It is not the cut, copy, paste research. It is the research that is based on the sound philosophical background. This is the need of the hour. Thank you all.
That we must agree that what he is telling from his experience, long experience. Orco Professor Director Dr. Subhash Singh has joined.
I think he's in
Hello.
the flight. I think he is in the
Oh,
flight.
okay. So let us continue. So far we have heard from our brilliant teachers that there are vacant seats, there are lack of confidence. Today's subject was to increase knowledge, aptitude, and perception. So to improve the perception, aptitude is essential. Unless you are experts, aptitude is high. So it is very difficult to develop perception. And to achieve aptitude is very difficult if we don't have sound knowledge in subjects. So anyway, so far we have got as a conclusion that students are losing little bit confidence regarding homeopathy. And from our brilliant speakers, we have heard that the solution is our training program should be stimulated or patterned in more clinical oriented way. I can tell you one example from my experience from Calcutta Homeopathy Medical College. There our teacher was Professor P.C. Pal, Dr. P.C. Pal. In the first year, second year, when we were studying organon, we went to him and we heard he is a very good teacher in organon. But he used to teach Medica from first year. So when we told him, sir, will you please teach us organon because we are not getting any taste of it. He told one thing, see boys, go on chewing dry grasses, haze, like organon. You will not be able to realize until you study and see philosophy or homeopathic philosophy of organon in later period of your study. When he went to fourth year in BHMS course, he started taking Medica and homeopathic philosophy. And I am not exaggerating a little bit, not even a list, that all the things we have studied in homeopathic philosophy, starting from Hering's law of pure, 12 observations, all the things he has shown in IPDs and OPDs. He was not a very good orator, but a brilliant teacher to show many things we have seen from him, fourth observation, fifth observation, sixth observation, 12th observation, all the observations we have seen in bed. So we are bound to develop the confidence on homeopathy. What we are studying in the books, we are seeing in the OPD. Patients are getting cured by the single prescription and in exactly the pattern mentioned in the philosophy. So what is needed is, Dr. Pannalal was telling that this practical training must be very sincerely done to develop the confidence, to develop the aptitude of the students. For this, definitely OPD and IPD should be a little bit bigger, but it is not easy to make OPD, IPD bigger unless we show the successes to the patient and to the students. If we are able to cure one rejected case of the OPD, then that patient automatically he will bring another 2-3 patients in the near future. So we must be very, very sincere to show our students practical applications of organon of medicine, philosophy, what we are seeing. And another very good concept we have got that all the other subjects other than homeopathic subjects, organon, mathematics, 11 subjects that should be modulated homeopathically oriented. Say for example, we are studying hyperemia congestion in pathology, but relation with belladonna arnica that should be shown to the patient. All the pathology, all the physiology with what we are studying that should be homeopathic oriented to some extent. One more thing I want to tell you from the discussion that the homeopathic system of education should not be modulated as per conventional system of medicine. That is the fatal attempt because two systems are completely different. This rejection of organon and mathematica from first year is definitely not a good concept because what I am telling, to learn one subject, to gain knowledge is something different. When the knowledge of theoretical knowledge will be applied and observed sensually, means by ears, eyes, and all the 5 senses in OPD, IPD, and in the classrooms also. During our time, I will tell you one example. Dr. M.M. Dotto prescribed one Hyoscyamus patient, one respiratory distress patient, asthma. Then you ask, sir, Hyoscyamus? He took the patient and asked him to come at 3. So patient came at 3. We 10, 12 students were surrounding the patient. Dr. Dotto told us that you take the case history and select your own drugs separately. We all took the case history in details before him and selected separate drugs. He asked one after another, what is your drug and what is the reason? Tell me the evaluatory symptom. We all told. Ultimately, he showed his prescription, which was giving improvement, brilliant improvement by Hyoscyamus. Then he told me, now you find why Hyoscyamus was given and patient is improving. We started our level best, but you could not found. Then he told, you have forgotten to think in philosophy that physical patient with physical complaints, mental symptoms should be given more emphasis. Have you not observed that the school teacher mistress is knitting wools before the students and doctors in OPD, special OPD at 3 when she was separately called, and laughing as we call it as jatra. Then actress, his laugh, Ivula was visible from outside. In such a manner he was laughing his jokes by Dr. M. Dotto. So that is the teaching. That is differential mathematica. What lies the difference? Why patient is improving? Why my drug is wrongly selected? Why lies the lacuna? This sort of practical training on Materia Medica organon is very, very essential. We are teaching belladonna, but how many of us are bringing one belladonna patient from OPD and showing this is belladonna difference from other drugs? So anyway, many beautiful learnings from our brilliant teachers. This education system definitely can be improved. During our time, except one of my friend, his father was a private company manager. He got a good service that he joined in service. No second student in our classroom from Calcutta Homoeopathy Medical College did other than homeopathy. So we got that type of confidence by seeing from our teachers. So please don't mind for telling this. We must be very much careful. We have to show the students ability and efficiency of homeopathy. Automatically, a student will try studying. They will get test for study. Automatically, they will develop aptitude. And once they get knowledge and aptitude, automatically perception will come. So anyway, let us, in second round, let us get some other information from our brilliant teachers. Now, may I request Dr. Parthopratim Rai to give some other ideas? Please, Dr. Rai.
Sir. So the discussion was fantastic. I may miss the point anyway. Another issue from my side is, because I have got a very learned senior and real educationists of more than 30 years experiences. So teaching, I have got a little bit of 22 years. So my question to the panel is, whether it is a time that we have to redefine homeopathy. Why I am telling this thing? As Rajat said, that was a fantastic orientation. And I appreciate Rajat. That classical homeopathy, that was, I missed actually. But when we speak of a homeopathy, a single medicine, and single dose, that was Hahnemann projected during his time. What I personally feel, at that time, the homeopathy was in a simpler way because adulteration by other drugs, the environmental changes was not there. The life was a bit stressless. Now we are facing a population having some allopathic drug, for example, anti-diabetic, for example, steroids, and they are coming to us. And I cannot stop steroid instantly. So what Hahnemann proposed, the unadulterated picture of the disease, that is impossible to get. So whether we will restrict a single drug, whether we will restrict to a single dose, or there is a question of redefining homeopathy as per the demand of the time. This is my question. The panelists obviously like to feed. I want this thing. Number two, what Dr. Kisore said, whether is it a time that modern pharmacology should be included in a BHMS syllabus? Because when the people is coming taking a drug, I'm not giving example because we all practitioners have several examples of allopathic drug bad effects and the patient is coming with us. So if it is at all required that a part of the modern pharmacology should be included in BHMS syllabus. Number 3, what Roger the beautifully pointed out, the psychosomatic concept. Now, this psychosomatic concept, how to bring it into practice? Whether there is a standard method of case taking, especially evaluating the mental symptoms, or there is a chance that modern psychological tools like the 5 factors questionnaire, like Myers-Briggs personality indicator tests can be applied, that can be tallied, because the world accepted the 16 type of personality, and if they can be included in a homeopathy syllabus. Because ultimately what I concluded or finished, that if a syllabus does not give the student the courage to practice, because toward close again I would like to refer, the homeopathy will die in the institution, exactly not like that, but he also supported homeopathy will live by the life of the practitioners. So my question is, yes, change in the syllabus is not a big issue, but the uniformity is not coming till 30 or 40 years. So I feel the policymakers, what Rajat rightly pointed out, the study of the market. Now the study of the market is actually meaning how much homeopathic drugs are getting sold. And we have seen it is increasing ups and downs in homeopathy. With the time of this corona, what Rajat said, from my experience in the state of Maharashtra, the homeopathy, Ayurveda and Unani people and students, they worked more than the allopathic people. They have contributed like anything more than these allopathic doctors. They have gone to the bed. I have seen. And because I'm living in Maharashtra state, I not for a single day stopped my practicing homeopathy. And homeopathy was not allowed by government to prescribe. We had written several times, but anyway, I'm not trying to bring this worst experience during that time as a homeopathic prescriber. Anyway, so I'm going back to my idea. Whether this allied subject correlation means it is to be correlated, what Kisore said most probably. That was the toxicology and other things. So this is not a theoretical aspect. This is entirely practical aspect. And this is to be done on the patient. Now, this how can be collaborated? How we can bring the allied subjects with homeopathy in a single table. That means one case will be studied from the view of medicine, miasm, from repertory, from Materia Medica, from homeopathic philosophy. And then the prescription should be made. Because the problem is, sir, homeopathy is ultimately the individual's art. Homeopathy is ultimately the individual's art of prescribing. On the same case taking, the same drug does not come because of several views. So my humble submission to you people, that what I have talked, what the panel thinks on that. Because just want to tell one thing regarding mental symptoms. If we study the book Pioneers of Homeopathy of Bradford, and where he is directly copying Gross regarding, I'm forgetting his name, just one moment I will see and I'll check and tell you, that he writes, one moment, he writes, the mental symptoms came from Lambert, most probably, I'm forgetting him, sir. Yes, sir.
Dachshund.
না না আমি একটু দেখে বলবো কি, এক সেকেন্ড আমি একটু দেখে নি প্লিজ, এক মিনিট। Gross, Dr. Gross, he is writing regarding the Langhammer. Langhammer was one of the good number of drug prover of Hahnemann among the 50 provers. So Gross writing about Langhammer, the mental symptoms given by Langhammer was his personal symptoms. So where it will be standardized. Number two, on mental symptom, when we talk of Kent, I personally have studied 111 cases of Kent from lesser writing. They are only on 5 cases he prescribed basing on mental symptoms. I can give you the statistics.
And naming.
Sir? Huh, sir? So only
And naming.
5 cases. Yes, sir. Yes, sir. And only in 5 cases, Kent prescribed basing on mental symptoms. More 5 cases, he put mental along with physical. I have repertorized the cases personally from Kent's repertory. If we omit the symptom also, the drug list does not change. So it is the bitter truth. Now being what we can do for that, because this history we have to study, because we have to tell a spade, a tooth is tooth. Sir.
Thank you, Dr. Roy. Many thanks for giving good queries to the panelists. Now, Dr. Kisore Kumar Naskar, please. Your views.
Thank you, sir. Actually, whatever our panelist says regarding the education system, the curriculum, and also the practicability of the homeopathy in the field of suffering humanity. So actually we need the application of a drug in the way of scientificity. It is a burning question, and it is the topic also. The practicality with the combination with the reality in the present scenario. Whatever Dr. Partho Rai says, he's my best friend also. The scenario during Hahnemann's time or Pioneer's time and scenario today is totally different. But principle is same. We have to obey the principle. We have to obey. But side by side, if there is talking about the single medicine with single dose, Hahnemann in his first life, in the first edition, he said that. But afterwards, he changed. And not only that, even I think all the panelists knows the name of Luz, Dr. Luz, who has edited the 6th organ of medicine, and it has been banned. Dr. Luz says Dr. Hahnemann at the last time in his 6th edition, at that time it was not published by Hahnemann. Hahnemann says that yes, I am agree with the multiple drugs, but not at a time, but alternative. And Dr. Dunham also says that yes, when Hahnemann said that, but we have a discussion with Hahnemann that it should not be, because our future generation will be a bad line. But it is a difference between the practicality and the idea. We have to understand the practicability. The present pathology, if we prescribe a particular medicine at a time suppose for 1 month, because patients are coming from 100 and 150 kilometers away from us, he will not come 1 to 2 days after my prescription. It is very difficult. 2 days. So for that point, if I prescribe a particular medicine for 1 month without seeing without observing within this period, it is practical? I think no. So something required. And not only that, in our OPD, more than 50, 60, 70 patients are there. If I give my mobile number to all the cases, then what will happen in my life? Is a practical situation. So there are some options. Dr. I have forgotten the name of British. He said that we can think of the prescription related to our soul and related to our body. According to our knowledge, if it is clarified, if we understand what he wanted to say, the medicine for the soul means the constitutional medicine based on miasmatic point of view, and medicine for the soul, body is a pathological point of view. Side by side, the patient will cure very rapidly. And today's generation wants rapidity. And what Hahnemann says also, gentle, rapid. Not only gentle, but rapid. मेरा करण अर्जुन आएगा, कब आएगा वो चलता ही रहेगा. But we have to give the relief now. And that is why with the constitutional medicine, if we prescribe the pathological point of view a particular medicine, because organopathic medicines are there, sufficient numbers of their medicines, what will happen for them? So what we are doing daily, we are proving the drugs, different types of drugs. So what is the utility of that drugs? So we can think of, we must think what we can do in our practical field. And in another point, in research level, science is not fixed. Science is a continuous process. So our homeopathy also will be in continuous process. So the knowledge of pathogenesis from the drug proving, from poisoning or clinical experiments or observations of the pioneers are there, and their applicability. But nowadays, some researchers are doing what pioneers has experienced. They have a question whether it is true or not. I think it is not the way. I think we have to identify, we have to give attention on the pathogenesis. What is the capability of the drug? More capability, not what our pioneers says. On that particular point, then the drug actions, the capability of the drug will be expanded. And on that point of view, some researchers are doing, suppose in a rheumatic arthritic patients, RCT on rheumatic arthritis with individualized medicines, by giving individualized medicines, the RCT. If it is negative, then what will happen? Our principle is bogus. So we have to identify where to be the research point, research will be there. In which point? I think it should be on the pathogenesis, the capability of the drug, more capability, the revealing. We have to reveal the others' capability, others' pathogenesis of the drug. There will be opportunity of us to prescribe that particular medicines or other medicines, any medicines. So my point is, we have to change ourselves with the name of individualization, with the name of totality of symptoms. Yes, it is there. But we have to add something more scientifically. And that is practically the area where we can progress. And it is the development of our science. Thank you very much.
Thank you, Professor Naskar. for giving his conceptions. Now let us request Dada Dr. Pannalal to provide few more information regarding this
Thank
subject.
you. So, as regard the syllabus, um, Dr. Chatterjee pointed out that organ on first BHMS, organ on inclusion of organ in the first BHMS. I am a teacher of organon. I was, now no more. Anyhow, as a teacher of organon, I can say it is better to start organon not from the first year, better to start from the second year. Let the student to study the huge course of physiology and anatomy nicely, acquire a full knowledge on that. This is very, very important for any medical person, any medical person. So to develop a complete medical person, that is physician, knowledge of anatomy, physiology is very, very essential. They should be given chance to study alone the physiology and anatomy, including pharmacy. Okay, no problem. But from second year, it is there is no problem at all, because we have enough time to cover the syllabus. Not only that, practical, theoretical, practical, every training can be given in the next 4 years, 3.5 years. Regarding the homeopathic orientation, this is definitely homeopathic orientation require extremely to develop the confidence of the students. That orientation to be done, as Dr. Chatterjee told, practically, definitely giving practical training. And a patient, Dr. Rai pointed out how we can assemble all the subject in a single table. The table is the patient. Patient is not the subject. Patient is a table where we can have all the subjects. There, in the same patient, we have the anatomy, we have the physiology, we have the pathology, we have the organ of medicine, and we have the issue. That's why we need to give maximum study, maximum experience to the students by practical training over the patient. To study anatomy, to study physiology, to study pathology, and also the other, these are Materia, Medica, organon, even all other subjects can be studied in a single patient. And whenever, where it is, which subject is dominating in a patient, sometimes anatomy, sometimes physiology, sometimes particular Materia, Medica, though all the subjects can be studied there, but in one patient reflect very nicely to particular poem, reflecting particular subject to understand. That is very important. And if students are exposed to the number of patients, to that will be sufficient to understand what is not knowledge. Knowledge allows understanding of the subjects as well as homeopathy as a whole. So orientation to be made through that only, and we have to give orientation to love homeopathy there, like we love to our girlfriends, we love to our dearest family members. So they have to adapt it to love homeopathy through this practical training, because they will get everything with their direct senses. That is the knowledge, direct senses. So that is knowledge two types. One is, this is called immediate and the mediate. Mediate in inferential. It is not seen by our senses, but some way that some facts are known through some way than the other senses, and that is inferred, but which are directly seen by our senses, feel our senses, that need not require to infer. That is direct evidence, direct evidence. So here they will get the direct evidence of the subject. Definitely that will create much more confidence on that, and definitely they will be able to love homeopathy. They will be oriented to homeopathy. It need not require to separate orientation. It requires if we teach students in that way directly, that will call that will give the orientation of the students. If we, now the modern pharmacology, Dr. Rai questions whether that should be included or not. I feel that it can be included, but everything have this your bad and good side, definitely. But here is a good side, because number of this your patients now, most of the patients are coming to us. They are after using this your allopathic medicine for long time, and they are suffering from after effects of the medicines. To understand that one, that how to neutralize that one, and how to separate the medicinal symptoms from the original disease symptoms, to understand that one, that realization of that one, the knowledge of pharmacology is definitely required. We don't have any pharmacological knowledge, but still, as a practitioners, we need sometimes to go through that books which contains, or the leaflets, or the content that leaflets within the medicines, the after effects or side effects, or the pharmacological effects. Sometimes we go through to understand the particular symptoms in a patient whenever we are getting such patients. But it is definitely that knowledge is not sufficient for us. That if it is included in the syllabus, it will be helpful for the students as well as in practice. Now, regarding dose and repetition, single dose, we are telling single dose, single medicine. Definitely, single medicine is all right. Single dose and dose. As regards the dose that you see, 50 milligram potency, repeated doses. Hahnemann never said that you should not repeat single medicine in single dose. Single dose means once at a time. The amount taken at a time. So you have to give at a time, but that doesn't mean you cannot repeat. That is, and if you repeat that one, unhomeopathic, never. Whether it is a low potency, whether it is a higher potency, whether it is your highest potency, no question. And also, as regards to repetition, that depends on the needs, requirement of only the patient. If you study the patient as required, you can repeat. It is not that 10 potency you have given, we have to wait for 3 months or 4 months. Not needed. Sometimes you require to that. There are patients in my practice I have seen even 15 days, 20 days, or this 1 month. Sometimes it's required. That is, there are several circumstances which can destroy, which can minimize, or which can cease the action of the medicine, even in the 10 potency or 1 M potency. So that depends on the case. We can repeat that one. That is not unhomeopathic. Homeopathy, definitely. And another thing, scientific investigation, and Dr. Naskar pointed out very nicely that the scope of scientific investigations are enough in homeopathy, because this science is still having a field, larger field to study, and they're very small, your top point or hypothesis can be framed, and accordingly you can study. It needs a separate discussion. What are the different field in homeopathy which require scientific investigations, and which extent we can do. And also another, I told earlier that we need the help of the modern technology. That that modern technology help us in a lot in practice, in the way, in the management, also is your prognosis, also in the selection of medicine, definitely. To eliminate symptoms, which are the symptoms of the disease and which are the symptoms of the patient. That very from my own practice, I can tell that modern technology is very essential, and that also create confidence on the patient. That also create confidence of the physician himself. If I do not know what is the exact pathology happening within the brain or heart or lungs or this your kidney, and how far I can treat, and what are the symptoms actually coming from the pathology, and that depends on the pathology that one should understand before analyzing the symptoms or the making the totality, and also the prescription, and as regard the dose and potency, repetition, etc. Many things depends on the pathology. Many things. What the Dr. Naskar also told regarding the dose and potency. Yes, depends on the body and mind. That is for the anti-miasmatic treatment as well as the organopathic medicines. Definitely, there are several types of patients we are getting where only the physical symptoms are there, where there is only the mental symptoms are dominating. And there are cases where we get the both mental and physical symptoms are in combination equally important. So in that cases, and even clearly told or given instruction where to give the which type of potency, which type of what dose we need. Mother tincture also you can prescribe. That depends on the that is the state of the pathology, type of the symptoms. That is not unhomeopathic. If we go through our masters also, there you will have in boric, and there's some other stalwarts. They used to prescribe medicine in very low position, 1x, 2x, mother tincture, like that. And another group also very high potency, like cane. So everything, these are not, we can say these are not homeopathy. Definitely. Law of similia must be there. Law of similia must be there. A minimum dose in respect of the particular case, respect of the particular situation. The minimum dose, he never given the amount, what is minimum. He said the amount, minimum amount required to stimulate the vital force, to create a primary action on the patient, this much. So he never gave the amount to be given at a time, which can be called as minimum. There is no such definition. So that's why mother tinctures also in a few drops you can give depending on the gross pathology. But the symptoms you are considering similar symptoms. We know that medicines which are highly dynamized, they give the finer symptoms. They give this more this your characteristics symptoms. But lower dose mother tinctures or they give this your pathological symptoms, gross tissue symptoms. But mental symptoms and the final symptoms comes out out of the dynamic action of the medicines. And pathological symptoms, what is called gross pathological or tissue symptoms, tissue changes we get from the lower dosage. So similarly, where we are getting the tissue changes, gross pathological changes, there we are giving lower potency. And where there is functional changes, most of the mental symptoms are very dominating. Physical symptoms are gross pathology. Pathology is less, rather. There we are giving highest potencies. That instruction is already given by the Hahnemann. So here is no controversy. I feel so. Thank you.
Thank you, Dr. Dey. Many thanks. And now we may request Professor Chatterjee to add something more in this subject.
I will take
Professor
very
Chatterjee,
little
please.
time. Thank you. Dr. PLD already mentioned everything, every point. Nice, wonderful. I know that Dr. PLD will deliver on this, the concept of dose, the concept of this pathological dose, etc., the functional areas, the higher potencies, etc. Dr. Partho, I will only mention, he mentioned about the name of Stuart Close. So if I can refer Stuart Close in one gross pathological damage when he mentioned about the digitalis in much more huge potency. It is not in the dynamic concept. So it is not on an homeopathic approach. So even Dr. Master Hahnemann, I think he is the master of clinical medicine also. He also perceived the limitations of clinical medicine, the application of homeopathy in clinical medicine. So that's why aphorism 67 footnote arises. Not only in that, in many places he mentioned about the limitations of our pathy, where the scope, like Dr. PLD was talking about, that the high dynamic concept, the high dynamic diseases. So I can remember George Vitulkas during COVID situation when he told that the disease which is prevailing COVID pandemic, the homeopathic system of medicine, which is homeopathic system of medicine, that may not be applicable for this type of COVID situation. It may not be for that. So where homeopathic dynamic concept will apply, we will apply, and where these pathological concept, what Dr. Kisore was telling, Dr. Partho was telling, that also we have to individual, that also we have to diagnose. So on the depending on these type of different type of stages, different type of diseases, different type of conditions, the concept of this singular concept of this dose differ. So it is not that what is Dr. Kisore is telling and what is Dr. Partho is telling, Dr. PLD is telling something different. It is the same thing, but we have to understand the big spectrum of our applications. Again, the in the changing environment, Dr. Partho was telling, changing environment is that, but also we have to acknowledge that in the past, when organon was written, the concept of the concept of local disease, it was concept only as one tumor or one moles or single, only one symptom. But nowadays you can see the most of the cases in the changing concept will give you concept of this type of local diseases, this type of concept, because where you cannot get the symptoms, of malaria, of chill, fever, heat, but ultimately diagnose malaria. You cannot get the classical symptoms of dengue, but dengue was diagnosed. Even the COVID also, even the typhoid, in most of the cases, the COVID cases prove false positive cases. So these are the times which was organon is written since long, but now we can experience it is much more incoming. So, this is one. And the psychosomatic concept, the scales, definitely we will use all the modern scales, but all those scales, it is be better or convenient to us if we make it on our homeopathic orientation, and then we will validate it. on this. If the validation can be done, because already this scale is validated, and if the permission can be given on the basis of our homeopathic orientation, if the same scale can be used, we can use. But if some little modification can be required for homeopathic orientation, we can make it, we can take the permission, then we can make it. So because if you go through the research pattern, the most important part is the meta-analysis. And then yes, sir, the case series studies is the basic path, which is in the last part of the pyramid, and it is considered to be very less important one in the research part. But from homeopathic point, we can think that this is our strength, so we can concentrate on that. So all the skills, all the validated skills, if we make some little modification with homeopathic orientation, this is our challenges. These we can apply. Another thing, we must standardize homeopathy, but we should not forget the name of Richard Hughes, because most of the time Richard Hughes was very much criticized that he is not doing homeopathy. He is considering lemon juice to scurvy, and he is not doing homeopathy. But this is the person who in the Medica Pura, you will all know about that who wonderfully did that. What you tell about Langerhans, the same thing he mentioned, that what symptom is the right one, what symptom maybe it should be deleted. So since I probably since Richard Hughes, no one now PG is going on, PhD is going on, but the literature review, the literature research is very infancy, is in infancy. Till date in Materia Medica, Uzina, Bride's disease, this type of terminology is there. So we can think of the literature research also, and we should not forget the name of Richard Hughes. And last one, that is the Dr. They, very senior, my Dr. PL Day. I have not mentioned that organon is in the first year. I told that I am expecting, or we are expecting that organon may come. Also, whenever organon will come, it will be not within 10 months or 1 year. The same pattern, the 18 months, with the 18 months if organon come, because the very basic fundamentals things, the students are coming with the +2 level knowledge of science, and they are very much with the materialistic science. So little bit of ideas, little bit of history, little bit of just to make interest, just to grow interest in the subject. So touch of organon and Materia Medica may be essential if we consider 18 months, not within the 1 year. It is impossible task within 1 year. So that I mentioned. So overall, this is, I think Dr. Partho mentioned all the 3 points I have mentioned, and Dr. PLD also. So this is my, what about my thinking, that we must be very update on homeopathic subject, but we must be very update with the clinical medicine, and we should not be biased with our homeopathic philosophy. With very openness, with very wide sense, we should accept anything new, and whenever we will accept this, that will be modified as per our homeopathic orientation. This is the challenge of the homeopathic education. Every new thing we should accept, but with the homeopathic orientation, we should accept and apply it. Then only homeopathy can flourish. Thank you.
Thank you, Dr. Professor Chatterjee. Many thanks to all brilliant speakers. Now, Bidyut, do we have any questionnaires from viewers?
Sir, not yet. I'm trying to find it out, but no questions so far. But we can carry on with the discussion. So,
Then, with the permission of all panelists, I want to add a little bit more that regarding Dr. Partho Pratim Rai, single medicine. What I like to mention that homeopathy is surviving for curing of diseases, usually refused or critical cases by the conventional system of medicine, and that definitely by constitutional single medicine. That means a constitution, a totality, individualization can never be two. But for tackling of the situation, as Professor Kisore Naskar was telling, that depends according to situations. If we give emphasis on palliative medicines or some allied medicines to assist quick improvements, then there is a chance of becoming weaker in constitutional prescription and individualistic approach. That might cause what we are finding today. Now our students, they are to some extent skilled to palliate, to cure short cases, but when the cases become diffuse cases, so-called incurable cases, they are in trouble. They are not that much successful. That is the reason why students are gradually diminishing in higher score study. Students are losing confidence. They are not able to cure the refused cases, for which usually patients ultimately come to homeopathy. So we have to be very much well trained to treat those refused cases by constitutional prescription, by well taken case history, and by that single medicine. Means single medicine means the constitutional medicine, I mean. That may be changed time to time, but we should not be more interested to tackle the situation. If you go in conventional system of medicine in any hospital to any professor, in OPD or IPD, you will see he will prescribe only one medicine for a disease. But if you go to his chamber or if you go to a private practitioner for the same disease, that doctor will prescribe that medicine, specific medicine for the disease. Plus, he will give some vitamin, calcium, minerals, this and that, and 9, 10, 11 medicines. That is tackling the situation, but medicine is one. That is why that should not be encouraged to the student unless the situation becomes threatening or the case may go out of our hands. We must tell the patient that this is the way of treatment. If you fail in difficulties, you can consult your local physician or you can consult to me for short-term relief of your complaints. But we have to be very cautious that by relieving complaints, we might lose important symptoms for our constitutional prescription. If we improve by short or palliative drugs few important symptoms, then after improving of those superficial symptoms, that case might look like some other drug totality. Original totality individualistic medicines may go out of our mind. Means patient has improved to this, that, those complaints, so patient is improving. Forgetting the original medicine, constitutional medicine, then another picture will come by after palliation, which will guide us to some other medicine, which will never cure homeopathically the patient. So we must be very, very cautious to think for second prescription, for losing of the cases and for failures. Next, regarding psychology, I am telling, Professor Roy was telling, we had one teacher, Pannalal knows, Madam Sunipa Sinha. He was MSc Psychology, MSc MD. So we requested him to modernize this mental chapter of Kent's Materia Medica according to modern psychology. He tried for 6 consecutive months along with his friends. Ultimately, he refunded the book to us and told me, Kalyani, it is not possible by modern psychology to make a structure of your homeopathic Kent mental symptom. It is so detailed, so fragmented, so finer. Psychology is yet to reach to that point. I am not making a single word extra. This was simple language and refunded the book. It is not possible for us. So what is my idea? Instead of psychology training, if we concentrate more on the mental symptoms of Kent and other stalwarts, to train them accordingly by teaching the personalities only, that will help us much more, because many of the symptoms of our mental chapter of Kent repertory and other repertories are usually overlooked by us. We don't care for them. That is more important. Regarding another point, pharmaceutical knowledge, it is a very dangerous thing. If we insist on pharmaceutical knowledge, because we know that every conventional system of medicine has got number of side effects. Every medicine, there is no medicine in the conventional system of medicine where there is no side effect. So to learn all those side effects, it will be a very exhaustive and time killing and diversion of mind. What Hahnemann has told us, that beware of making mongrel sects. Our student will be interested in short-term medicine. So once the patient will be confined, that paracetamol can relieve pain and fever. So he will forget to differentiate between Eupatrum, Parponitum, Bryonia, Arnica, and Rostop's pain. He will immediately insist on paracetamol. So that might be a dangerous attempt like palliative medicine prescription. If we indulge on training on this subject, there are enough scope to learn side effects by more nowadays net system, Google system, or any other software system. But one thing is sure, that all the side effects of modern medicines are usually mostly confined on the presenting complaint. But constitutional complaints, structure of the body, as we say, mental and physical constitutional symptoms are seldom they are being changed by modern conventional medicine. So for chronic prescription of chronic diseases or constitutional prescription for chronic diseases, we can then ignore the clumsy pictures of the presenting complaints and can safely depend on the constitutional symptoms of the patient for our achievements. But gathering knowledge is not bad. But if a sharp weapon is given to a child, that may be harmful too. We must be very cautious. So anyway, today's what I think that today's brilliant this panel discussion is more in practical training. What theoretically we are having, it is all right. Philosophy, Medica, organ, everything is all right. We have to make it practical. We have to develop the confidence. Then once they get confidence, automatically love will grow up. During our time, in first year, when economics was being taught in my class, teacher is telling, if you get any case suddenly comes with a violence, severe thug, give economics. Then one should say, we will give economics. But yes, taste the sweetness of Rasagolla and Pantua. There are difference of taste. So unless you do it on your own hand, how you will understand the difference between Belladonna and Aconite? You give in your policy, immediately come to us and tell us that we have given. We will help you, we will guide you. So accordingly, as we are insisting students to be trained in OPD, IPD and classes practically, similarly, we can give encouragement to the students that you try your medicines in your family members, because they are very much eager to see that you are learning and you are coming in use of our family. Then immediately talk to your senior teachers to avoid risk. So anyway, in all respect, we should be continuing to encourage the students for practical training, doing by their own hands, seeing, observing, and gaining experiences. Then automatically aptitude and this perception will automatically come. Anyway, thank you. Many thanks for these brilliant discussions of the day by all the experienced teachers. Definitely homeopathy will improve. Hahnemann himself made 5th editions. After that 6 came. So we should gradually progress, as Dr. Chattopadhyay was telling, but we should never forget the principles of homeopathy. If we forget the principles and try to adjust the situation, circumstances, then we'll be in danger. What is doing practically in India, what was done in America, and the disaster we know regarding homeopathy in America. We should be very much cautious to restrain that type of rather bad experiences in India. Thank you very much. Anything anybody to add?
I missed 2 points. I want to add just 2 points. As per Dr. Parthora told that regarding the syllabus in modern pharmacy in the syllabus. So rightly, whatever Dr. Kalyani sir told, it is right. But for the side effect purpose, whatever 100% I agree with you. But if in the practice, the common side effects of the commonly used drugs can be known to all, it not means that with that knowledge they will practice or they will be allowed to practice with that concept. That pharmaceutical knowledge will not allow anyone to practice modern medicine in the society. But the very common side effects of the like amlodipine drug, like amlodipine drugs can cause in the prolonged use the swelling or the dry cough, or the on L-troxin very much susceptible to cold. Like these very common things that should be well known to the practitioners, because they will get lesson from these during their prescription. This is the one point. And Dr. Parthore also was first point was how to accommodate everything that a Materia Medica organ on clinical medicine, all the things. If one have the idea of uterus and what is the form of uterus with the anatomy and physiology, with the support of the uterus, and if the simultaneously in the pathology part on the miasmatic part have the idea of the miasmatic constitution of the psychotic with the relaxed conditions, And whenever the prolapse will come in the gynecological part or medicine part, the prolapse, the first part, second part, third part, to the patient with the predominant syphilitic, the predominant psychotic will differ in the first degree, in the second degree, in the procedencia. So that relaxed part may induce the uterine prolapse. Again, the natrum mur, when convert to sepia with the aversion of sex to own husband, with the totally not use of the sexual function with the prolapse, that concept is the dynamic concept from natrum mur to sepia. And again, when the repeated abortion or repeated pregnancy, and if any type of mechanical injuries to that uterus and can cause prolapse, there's a different concept with the mechanical concept. So with the concept of anatomy, physiology, miasmatic, our homeopathic philosophy orientation with the Materia Medica, that can be accommodated in very many cases. And this is the challenge to our homeopathic oriented allied subjects teachers, just to make the homeopathic orientation of each line of the clinical medicines for gynecology, obstetrics, even our clinical medicines, every part, how to correlate, how to present, and also how to apply, because this is the applied Materia also. We are doing this, but in explanation, we are something lagging behind. And in the literature, it is the real scarcity of the literature in these homeopathic orientation of the allied subjects. That's
exactly. Exactly.
Really,
Pannalal.
understanding a patient and deciding its plan of treatment and management, unless you teach the students with different patient, it is impossible to develop the confidence of the patient, students.
Sure. Thank you. Bidyut?
So just Vidyut,
পেশেন্ট দেখানোই হচ্ছে কি আসল কথা, পেশেন্ট হাজার রকম পেশেন্ট দেখাও তাহলেই হবে, কনফিডেন্স আসবে, হোমিওপ্যাথিক্যালি ওরিয়েন্টেড হবে, different situation collapse definitely. What type of miasm they present with that particular patient, only practically if the students are demonstrated, only that can create confidence on them. That can cause understanding of the subjects, understanding of the patient, understanding of the patient. তাকে যে প্র্যাকটিক্যাল দেখাও তবে হবে, তা নাহলে হবে।
So Partho want to say something. Partho.
Actually, I put different aspects. So in front of the panelists, so that we talk in that way. So this was a lineup that I tried to make actually.
Definitely.
Understanding that is coming out. Yes, I did that only. So my first phase that was related to education policies. The second part was a real problem that the people are facing. What Rajat said, I agree 100% to him, that the bad effect or side effects of the drug that should be included in syllabus, because this is a dire need of the present situation. Second thing, Rajat, the application of these psychological tools in practice, we have to take the permission of the publisher. This is my personally, I want to mean.
Sure.
Yes, sir. I am doing my PhD on this topic only. That I am working on MBTI, Myers-Briggs type indicator. They have given 16 personality types. Already the psychological structure is provided. I made a repertorization. Most probable group of remedy that came out from the repertorization. I am giving the test scale to my patients. Patients are taking, they are coming to a type. I have got a group of remedy for that type, and I am differentiating with the physical results and aversions. And it costs.
Very good.
That I am doing. I do not know whether the result is going to come. And I am using stress scale, irrespective of the name of the disease. Whether before and after study, by this method, the stress is getting reduced. I do not know what the result is coming because 300 people I have to study on that. So the work is
Definitely. Result is something different.
second very problematic issue, sir. They charge high. No one is going to finance me. They
Right,
don't
right,
give
right,
permission, give it to me.
right.
So they charge high. How I have obtained the permission that I know. How much they claim from me and how much. So that is a separately entire issue. So doing a work with this type needs a funding. So it will not be
Definitely.
easy. And third thing, Vidyut probably may support me. Here questionnaire, the questionnaire that comes, that is in English. We have to translate into local language. So I did it in Marathi, sir. It is a rule.
Right.
Then again, that Marathi translation, I
That
confirmed
to
in
be
English.
validate.
Yes, to validate. English, that whether the meaning of the Marathi is same to the original questionnaire or inventory. It is a highly
Right.
dangerous
Double task.
work I'm doing,
Very
and I'm
difficult
fed
task.
up on doing this thing. So
No,
it's a
Dr.
trial.
Partho, Dr. Partho,
Sir.
we have made it. We have made it twice, and we are doing also right one. We are doing the third one. We have personally
Sir.
with my team. I know that 2 or 3 they have made many, but personally we made 2 this similar type, and third one is going on. So we have to do it, and our authority should take the responsibility, like our national institute, like our central council, like our national
Exactly.
NCA.
Exactly.
They should,
Exactly.
because the authority can have the power to make anything this type of scale also on the base of homeopathic
Yes, sir.
orientation. So
Yes,
we should
yes.
have at least 1, 2 in different part. We have to. This is a challenging job, but our authority also should concentrate on these type of panel discussion. The message that should convey, we should convey this message to the authorities that you have to concentrate on also this, because whatever from where you are getting your scales or from where I am getting the scales, that is from one
Yes.
of the authority. But in homeopathy, if India is considered to be a very good one, very good with our infrastructure, our human resources, so at least 1 or 2 type of this type of oriented, homeopathic oriented, innovative type of skills that should be from our
That
authority.
really,
It is our
definitely,
expectation.
definitely.
So that just I have said only the problem. This is also a kind of problem that a researcher is facing, sir. And
Yes,
later to
definitely.
convert and relate it to homeopathy, that will be the next part of the job. Whether we can add more something over there. Because, sir, you also feel I am not singly working. I have given 10 people to make it because I am poor in understanding Marathi. So
Good.
every time you have to face the hindrances. Every time. But still, I do not know what the result will come. If result comes, so
Whatever, even negative result in research is also valuable.
research is
You
valid.
carry on,
Yes, valid.
definitely.
So I am doing, and let us try what happens. 10 people they are working with me on repertorizing because
Good,
every
very
day
good.
we are taking the help of synthesis repertory and other repertories. We can consider the basic group of remedies like that. Thank you so much, sir. Thank
Thank
you
you
so
very
much for
much.
giving me
Many thanks
and
to all,
giving me a
and
chance to
really
talk before
Alumni
you.
Association is thankful to all of you for this
Thank you, sir.
brilliant
Thank you so
Right,
much,
sir.
sir.
thought exchanges.
Okay, thank you so
Right,
much.
sir. And as Rajat had pointed out, I had already been sharing this link with the authorities across the country because it will be live. It is live now, and will be there in the server of YouTube of NIH Alumni Association. Furthermore, Rajat and Panna sir and Partho, Kishore, all of you, if you can suggest how we can forward through email with the link like that. Those
Yes,
suggestions are very
definitely.
invaluable.
Okay, so that a proposal probably should have to made. Anyway, we'll discuss it later, how to do it and what to do it. And I will ask direct help from Rajat because
Okay,
he is known to us. We are having a
definitely,
same kind of
definitely.
mentality,
And he's also
and
having new thought,
he
brilliant
has got
thought.
like many innovative thoughts. I know
Definitely.
him personally for several years, So I'll personally make him contact how to make it can be more
It will be a
materialized.
great help
And
if you
he
convey
is
to
fully working,
Burdwan.
full-fledged working principal and working very nicely. I appreciate his work. Thank you so much.
Thank you. Thank you. We can make it one thing, Dr. Bidyut, that other Dr. Kalyani and Sir and Dr. PL they also we also will contribute one very synoptic whatever come out total today's panel discussion. We can make it a note in discussion the later on with the taking time 7 or 10 days. Then we can make it
Make it
in the your channel and also to
Good.
email. Yeah, because one message
Right,
Very
right.
good idea.
only doing the
Yeah.
only doing the discussion it will not fruitful, but what
Exactly.
what we want to make it that should
yes.
reach to the right part. This is
Right
very
person,
important.
Right, right.
Right person. Yeah.
right
Right.
level. Yes, yes.
Right.
Right. This channel is accessible to all of the panelists and the viewers also. And it's my humble request to all the panelists tonight to give your own sum up on this, so that we will be through our internal setup we can sum it up and will forward as Professor Rajat had already suggested. Panna sir, Patro, Kishore is having internet issues. Kalyani sir and Professor Rajat. We'll try to get help of Professor Subhash Singh, who is also probably in the
Right.
flight now on way back from Delhi.
He will not be able to join.
So yeah, yeah.
Okay.
So we'll take help of all of our panelists
Definitely.
tonight. Thank you,
Thank you.
thank you.
Thank
And
you.
with permission of sir, can we close tonight?
Sure. Sure, sure. Thank you to
Thanks.
all and good night.
Good night.
Good night. Good night, sir.
Good night.